with the Basic Healthcare Provision Fund, there is a portion of it that is allocated to the vulnerable groups, and we'll make sure
The federal government has promised that it would invest in 8,000 primary healthcare arenas with the Basic Healthcare Provision Funds (BHCPF). Professor Mohammed Pate, the Minister of Health and Social Welfare, disclosed this in Abuja during the unveiling of the National Health Insurance Authority (NHIA) operation guidelines. According to him, Nigeria has less than 10% coverage presently.
We expect faster progress and higher rates of increase in coverage over the next few years. And with the Basic Healthcare Provision Fund, there is a portion of it that is allocated to the vulnerable groups, and we'll make sure it gets to them. Complementary to what we're also going to invest in the primary healthcare arena, where almost 8,000 primary healthcare centers all over the country are going to be receiving funds through the BHCPF. Now, we would expand the space where others, private sector development partners, can contribute to accelerate. And as the fiscal space of the government improves, we should expect more domestic financing going into that direction.
WHO is there to support member states, organizations, and has continued to support the government of Nigeria in their ongoing efforts towards reducing the number of people suffering financial hardships due to illness. We are more committed as an organization in providing technical support to the NHI and SSHIAs, considering that effective implementation of these guidelines will require sustained capacity building, supportive supervision, and advocacy.
I plead with us. It's time for us to make it truly mandatory. Nigerians cannot continue to deceive ourselves that we can have a sustainable form of financing for the health system if we do not truly implement that mandatory aspect of the health insurance, except we don't want to achieve universal health coverage.
The Director General, National Health Insurance Authority (NHIA), Professor Mohammed Sambo, stated that the NHIA Act contains two critical provisions for the attainment of the universal health coverage.
The guidelines clarify the roles and responsibility of all stakeholders within the national health insurance ecosystem. They specify the basic minimum package of health services for all Nigerians and how the schemes will strategically purchase these services across the country. The guidelines specify standards for accreditation of critical stakeholders operating within the national health insurance ecosystem, as well as penalties for offenses committed by defaulting stakeholders. The document also recognizes the integration of state health insurance agencies as conceptualized in the national health as the health insurance under one coordination framework. I'm convinced that the NHIA operational guideline will be the guiding light for our nation's health insurance ecosystem.
It is important to emphasize the need to close collaboration with their counterparts in the states. We don't want to have guidelines that will still stay on the shelves, but we have to ensure ways to ensure that we have a result-oriented dissemination of the guidelines so that they could be effectively utilized at the sub-national level up to the local government level.
The implementation is very, very important and necessary. And it's not all over, but we must also have to study the act so that where there is need for amendment, it can easily be done.
However, the NHIA operational guidelines are secondary laws derived from the NHIA Act aimed at providing financial risk protection against the cost of quality health care for all citizens in Nigeria.